Hi, I'm Terry Larash, President and CEO of Scheurer Health. Every 3 months, we have what we call the CEO Connection Forum. In short, we host 10 sessions in a town hall format for all 500 of our employees. We have these so they can ask questions, find out updates to our organization, and even offer suggestions of how to better serve our communities. With COVID-19 changing everything in our world, we obviously are not able to have these meetings in person. And since you, our community, have been so supportive and key to our success, we have decided to expand our CEO Connection forums to include you. I want to thank you and everyone in the Thumb that has made this entire experience so positive and humbling for us. The amount of people that have paid it forward by buying our staff meals, sewing and donating over 1,000 masks, written letters of encouragement, or have gone out of your way to perform an act of kindness is overwhelming and heartwarming to see. Thank you for your support through all of this. The Upper Thumb has done an amazing job in following the guidelines set by the Health Department and CDC. Never has hand washing and wearing masks been so popular, and as we have learned, so critical in beating this pandemic. In my opinion, it is why we have had such a small spread of COVID-19 through our communities. Much like you, I am so proud of our team at Scheurer, from the physicians, advanced practitioners, housekeeping, frontline staff, and everyone in between. When new obstacles popped up every day, our team sprang to action and have been proactive in every way possible. Much like you following the community guidelines and staying home when possible, I'm confident that our efforts at Scheurer Health have limited the spread of COVID-19 as well. I always knew we had the best team at Scheurer, but to see them in action during a worldwide pandemic takes it to another level. On March 16th, we engaged Incident Command, a pre-established task force of key players across the spectrum of Scheurer Health to make sure we were ready on every front. This includes areas such as logistics, supply chain, clinical protocols, medical policy, public information, facility operations, security, and so on. Incident Command has been meeting on an almost everyday basis, and our team of nearly 500 healthcare professionals has taken the information and objectives handed to them on short notice and implemented all of it in great stride. For those watching this video, join me in showing your thanks and gratitude to our Scheurer Health teammates by commenting below. In our quarterly CEO Connection forums, I typically cover a wide variety of topics and make sure the most up-to-date information is in the hands of our team. Here is an overview of what we will be discussing today. Just before the statewide shutdown, we implemented the world's most advanced record system, Epic, with great success. As part of what we call the Scheurer Way, we received the results of our organization-wide employee survey and couldn't be more proud of our soaring positive numbers. When new requirements were needed to respond to COVID-19, we rolled out a number of new services, including pharmacy curbside pickup, telehealth, a pediatric vaccination drive-through, and thermal digital health screenings, just to name a few. On the other side of the coin, with the entire world practically shutting down, our finances had to readjust as well. But we are in a stable and optimistic position. And finally, we'll give you an update on construction in Bad Axe of our new facility and our fast care clinic being constructed within the new Meijer store. Epic. There are a few big names in the electronic medical record industry, but none larger than Epic. In fact, 72% of the United States has an Epic medical record, or what is commonly known as MyChart. All 20 of the top hospitals ranked by U.S. News and World Report all use Epic, including the Mayo Clinic, Johns Hopkins, Cleveland Clinic, Houston Methodist, and here locally, University of Michigan Medicine, Henry Ford, Spectrum, Mid-Michigan, Covenant, Hurley, and Beaumont. 4 years ago, we set out on a mission to become a fully integrated Epic system, and we have now achieved that. I am willing to bet that there were few and perhaps only one hospital in the entire country that was scheduled to launch a new medical record right at the beginning of COVID-19, and that was us. But I am happy to report that the transition was smooth and we are fully up and running. This was not a simple task, and special credit goes to the Epic Steering Committee, our super users, trainers, trainees, and everyone that was involved in one way or another. As with anything, there's still work to be done to refine and customize the system to truly fit our needs. But with Epic, we now have those capabilities in our wheelhouse. Now our patients can have their medical record follow them securely wherever they seek treatment. Despite the increased stress of Epic and COVID-19 at the same time, the timing truly was in our favor. By using Epic and MyChart across our entire system, our telehealth services are able to be utilized in a more advanced way with better outcomes in mind. The Scheurer way. Each year, we conduct an all-employee survey to gauge our performance and hone in on any areas in which we can improve as an employer. This survey was completed by over 75% of our workforce, and I am so proud of the results. When asked the question, would you recommend Scheurer as a place to work? Our workforce rated us in the top 10% of hospitals polled in America. Let me say that again. Scheurer ranked in the top 10% of all healthcare organizations in the nation. That is a 19% increase from our last survey. An improvement like that does not happen by chance. The implementation of the Scheurer Way initiatives have been successful in engaging with our staff in meaningful ways. It's dedication and passion to providing outstanding healthcare that makes Scheurer such a special place. We want to take this momentum and continue to move the needle with customer satisfaction. While we provide a great customer experience already, we know that there is always room to grow. COVID-19. What a crazy few months it has been. It's hard to even think what life was like before this new virus emerged. The response of our team at Scheurer has been truly impressive, and I could not be more proud. At the drop of a hat, our frontline staff took new regulations and services and put them into action immediately. Our primary care team worked with our innovation and quality department and launched telehealth in less than a week. Now patients can see their providers from the comfort and safety of their own homes. Our pediatric team, led by Dr. Carrie Rabanera, established a pediatric drive-through once a week so that children could stay on schedule with vaccinations and well visits. This is what makes Scheurer so special. Proactive staff members taking an idea that will benefit our patients and running with it to the finish line. Scheurer Family Pharmacy established curbside pickup at all 4 locations in Sebring, Pigeon, Caseville, and Elkton. By limiting contact, it keeps our patients safe, as well as our own team out of harm's way. You can learn how that process works on our website. And on top of that, the pharmacy team created vulnerable shopping hours for those who may be immunocompromised, advanced in age, or with particular health issues. Our team has been volunteering their time in conducting health screenings for the Laker Food Pantry distributions every Saturday. It's remarkable to see such kindness from our community to help our community. And one of the more high-tech items, our screening stations on our main campus now use the most up-to-date technology with no-touch temperature checks. Thanks in part from the Huron County Community Foundation, we received funding to purchase 2 infrared scanning cameras that can take a temperature without having someone in close proximity of you. After doing some research, we found out that Scheurer Health was the first healthcare organization in all of Michigan to implement this technology. It is advancements like these that outfit us with the most effective tools in defeating COVID-19. Thank you, Huron County Community Foundation, for your financial support. There are plenty more updates and advancements taking place at Scheurer Health. To learn more about them in full, go to scheurer.org/virus for all of the details. Now, a topic that goes hand in hand with this pandemic: finances. The economic ramifications of COVID-19 have been dramatic and unpredictable for our nation's economy. Most businesses in America have been impacted, including our organization. Fortunately, we were in a strong place financially before the pandemic hit, so we are still in a stable position. Our goal throughout this entire scenario is to preserve and provide the top quality healthcare that we are so well known for at Scheurer. It is our goal to remain as an independent healthcare organization, and we have no plans to change that. Just like most businesses today, we are taking proactive measures in balancing our decrease in revenue by managing our overall expenses. I understand what kind of impact that has had on each individual employee. We know that you have sacrificed in many ways, and I want to personally thank you for that. Our community appreciates it too. And speaking of community, we are excited to be adding another community to the Scheurer footprint. As many of you already know, by just driving by, construction of our Bad Axe facility is nearing completion. It is our projection that we will have our doors open to the community by Memorial Day, which is right around the corner. It is truly a beautiful facility and accurately depicts the level and quality of care that our patients deserve at Scheurer. I can't wait to someday have an official grand opening and open house, but unfortunately that is just not in the cards for the time being. Dr. Long Nguyen and nurse practitioner Jennifer Jones will be based out of our Bad Axe facility, Monday through Friday. On top of that, we will be offering pediatric appointments with Dr. Carrie Rabanera and nurse practitioner Lois Booms on Tuesdays and Thursdays. In addition to standard appointments, our building is equipped with a laboratory so that you can get your lab work done in an efficient manner and even have x-rays completed, all under one roof. We are looking forward to providing our integrative health model with this new location in Bad Axe. Our Fast Care Clinic will be located in the new Meijer store being built at the north end of Bad Axe. It will provide convenient walk-in service with extended hours once the store is open. You can go to scheurer.org/badaxe for all of the latest progress. With that, we have come to the end of our topics for this virtual edition of our CEO Connection Forum. It is so inspiring to see the level of dedication that our team brings to the table every day. Last month marked our 75-year anniversary of providing quality health care to our community. Something that COVID-19 can't change is the principles and values that have been the same since Dr. Claire Scheurer first opened the doors to Scheurer Hospital back in April 1945. A lot has changed since then, especially the size of our organization. But I am confident when I say that Dr. Scheurer is looking down and smiling, knowing the level of care that residents of the Thumb are receiving. If history has told us anything, we'll get through this if we can all do our part. When this is all over, we will be able to take off our masks, visit with neighbors, go out to eat, and enjoy everything that our great state has to offer. If there is ever a lesson to be learned from COVID-19, it's realizing what we all have in our lives. It might be a supportive group of friends, family, co-workers, and forever giving community, or as little as a wave and a smile from 6 feet away. Gratitude is a powerful thing, and at Scheurer, I am lucky to be part of it each and every day. Thank you for coming together and showing the world why it is so great to live and work in the Thumb of Michigan.